the personal details now. Name of the patient is usually for identification. Age of the patient, because the pregnancy risk many a times depends on the age of the patient. Very young ladies, very old ladies, say 35, 36, they are all elderly women. More than 30, they are called elderly pregnant, and there could be associated comorbidity, hypertension, diabetes, etc. And there is also a possibility of genetic abnormalities in the offspring, and labor problems are also more common in advanced age and in adolescent age group. The pregnancy may have aneuploidy in elderly women, and anomalies could be there. Growth restriction also is common once she is above 35. Teenage pregnancy, as I mentioned, hypertension, obstructed labor, infant feeding problems, and psychological problems could be more. Coming to the socio-economic status, this is computed after looking at the per capita income of the family, size of the family, then housing, the occupation of the family members, and also the details of the spouse, his occupation, his per capita income. All of them put together, you can say whether she belongs to an upper lower socio-economic status, lower or middle economic status. So there are various systems by which you can classify, and depending on the socio-economic status, some of the problems could be more common, like low socio-economic status is associated with malnutrition, anemia, small for gestational age baby, and fetal growth restriction, hypertensive disorders, right, unbooked nature, and maternal mortality, etc. Of course, even association of domestic violence. Same thing if she is from an affluent class. There could be possibility of pregnant woman being elderly, obesity, diabetes, hypertension, ischemic heart disease, and repeated cesarean deliveries could be the risk factor. Coming to the literacy, it usually works through socioeconomic status. So a literate versus illiterate can have almost all the problems of the low socioeconomic versus high socioeconomic status. Coming to the occupation, if the occupation involves long-standing exposure to toxic chemicals, radiations, or some of the drugs, and people who are working on night shifts, they can have lack of sleep, and these things may really influence the pregnancy outcome. And if you look at the occupation of the husband, if they are traveling out for a long time, there could be a risk of sexually transmitted illness and adverse effects on the pregnancy outcome. After this, we usually ask when she was admitted and when she was examined. Okay, so this is because the woman would have come to you with a diagnosis of hypertension elsewhere, and she has reached you. You have admitted her today, and after 4 or 5 days, someone examines her. You have already put her on antihypertensive. After 4 days, when you examine, the blood pressure is normal. So, should I call her a hypertensive or not? Similarly, with anemia, you have transfused 3 units of blood from today for 3 days, and 4th day, when you see she is perfectly fine. Is she an anemic lady or not? So, for these reasons, to know the effect of treatment, you need to really concentrate on when she was admitted and when you have examined her. Now, when you are presenting the further aspects of the case, you have taken the demographic details of the woman, admission and when she was examined, etc. Then normally in other situations we say presenting complaints. Okay, so here we usually start with the state of her pregnancy as gravida, para, and other things. Like, for example, a woman who is pregnant for the 3rd time, we say she is a gravida 3, para 1, living 1, and abortion 1, presenting with amenorrhea of 8 months. You try to understand the word presenting with. We don't say complaints of amenorrhea. Amenorrhea in a pregnant woman is a symptom and not a complaint. Okay, it is a welcome thing. She is happy with amenorrhea. Nobody is happy with complaints. So never say woman complains of amenorrhea 8 months. Always say the woman presents with amenorrhea 8 months. When you say a gravida 3, para 1, living 1, abortion 1, with 8 months of presenting with 8 months of amenorrhea or presents with 8 months of amenorrhea, and say whether she has come for an antenatal checkup or she has come with some complaints. Later on you can say she has come with complaints of pain abdomen, complaints of bleeding PV, complaints of loss of fetal movements, or else you can say she has come for a routine antenatal checkup. So this way you are going to start your sentence when you are presenting an obstetric case. Gravida means a woman who is right now pregnant. Whenever you use the word gravida, she should be pregnant at that juncture. Okay, so you cannot call a gynec patient as gravida. A person who presents with prolapse, you cannot say she is gravida 5 para 5. She cannot be. She is not pregnant now, right? So woman who is pregnant right now, only you should use the word gravida, and the number you put as gravida 1, gravida 2, gravida 3 will tell us what time she is pregnant now. Is it the first time, second time, third time? If you say 3, it is the third pregnancy. If you say 5, it is the fifth pregnancy. If it is the first one, it is the first pregnancy, which also is known as a primi gravida, and this includes the present pregnancy. Including this pregnancy, you should put it. When you say para, that woman should have carried at least one of her pregnancy to the period of viability. Assuming the period of viability to be 28 weeks now, which is used for definition, if she has carried one pregnancy at least beyond the period of viability, she becomes a para, right? So if you just say she is a paras woman, it means she has had 1, 2, 3, whatever number of deliveries which has gone beyond 28 weeks. Irrespective of the outcome, whether the baby is alive or not, we are not worried. So if you put a number there, it says how many pregnancies in the past. It doesn't include the present pregnancy because this pregnancy has not ended. Okay, so always para is less than the gravida. So if she is gravida 3, she cannot be para 3. She can be only para 2 or para 1. Right? So this is something which is very important. Whether the baby is alive or not, we are not worried. We always add one more word, like gravida 3, she is pregnant for the third time. Para 1, one pregnancy, out of this 3, one pregnancy has crossed the period of viability, that is 28 weeks, and we have put it as L1. L1 is one baby is living. That means the one which has crossed the period of viability had an uneventful delivery and she had the baby alive now, right? Dead babies, it could be born dead that died later. We always put it as dead 1 or dead 2, dead 3, depending on how many babies have been lost. Okay, so now out of 3, one baby was born and it is alive. So what happened to the other pregnancy? Because right now she is pregnant, that is one pregnancy which has ended with a live birth, that is the second one. What happened to the third one? So here I explain with A1. A means abortion, so always it clarifies what happened to the other pregnancy. So gravida should equal the para plus abortion. So if she is gravida 3, para 1, abortion 1. But this pregnancy included here, therefore 1, 2 and the present pregnancy totally will make it 3, right? So along with present pregnancy. So it should, this equation should be fulfilled. If in a single pregnancy 2 or 3 children are born, a multiple pregnancy, she has had a twin delivery, how to represent it? How many pregnancies she has carried to the term? It is only one pregnancy, but outcome is 2 babies or 3 babies. So what do? She is now pregnant, if you assume second gravida. Previously she had twin deliveries, but it was only single pregnancy. That pregnancy has gone beyond the period of gestation and she has got 2 living issues. Gravida 2, para 1. But living pregnancies are 2. Living babies are 2. This clarifies the doubt that this must have been a twin pregnancy. And ectopic pregnancies, molar pregnancies, everything will add to the gravida. She should be gravida 5. She could be gravida 6. But 1 molar, 1 ectopic, 2 abortions and only 1 living also. Right? And some people use the word even for ectopic, but not a well accepted terminology. So here 5th gravida, 2 living issues with 2 para and 1 dead and 1 ectopic. That means there is a twin delivery and 1 pregnancy, baby is dead, and 1 ectopic pregnancy and 1 molar pregnancy. Right? So living 2 says that the one of the delivery is a twin delivery.